you suffer from chronic pain and you're not sure what to do about it, especially if you don't have the money or the medical insurance to get the proper medical care?
Well, perhaps a clinical trial may be what you're looking for, but what exactly is a clinical trial and how could it help you? Here to talk about all that is Susan Angel from CNS Healthcare. Hi, Susan.
Hello, good morning.
Nice to see you again and your smiling face.
Oh, thank you.
So what is the goal of a clinical trial for chronic pain?
Right now what we're doing is we're looking at new medications for chronic pain where oftentimes people who have chronic pain have to take medication frequently throughout the day. One of the particular medications we're looking at is a once a day type dosing, so it might be more convenient and it might have better tolerability. So that's what we're looking at right now.
So how do you know, or if someone is watching right now, if they're suitable for a trial?
Obviously, there's lots of reasons that cause pain. Some of the things that we're looking at are people who have chronic low back pain, patients who have osteoarthritis, just your general arthritis type, or just general aches and pains that just aren't going away. So the best way to find out if you're suitable is to come in for an assessment, and they can meet one of our clinical staff, either our nurse practitioner, and they can sit through and go through your medical history with you and see if it's something that's suitable.
Is there anybody that would not qualify for this, like certain patients that couldn't do this trial?
Well, it's kind of hard to say exactly. I mean, there are numerous things that could include you or exclude you from participating, but truly the only way is to come in
and find out.
Come in and have that evaluation so we can compare things.
Yeah, so let's walk us through a little bit. If somebody is at home watching right now and they're thinking, yeah, I have chronic pain, I don't have the medical insurance, but I would like to receive treatment, what should they do? What's their first step?
They can simply call our office or they can visit our website. There's the capability to schedule an appointment there, and what they'll do is we get a 30 to 45 minute evaluation, and at that time they're able to discuss with someone face to face, what exactly is going on with them, their health history, surgical history, current medications, and then we'll take all of that information and compare it with what the specifics are of that clinical trial and see if they match up and are a good fit.
Now, you've mentioned before that not only do you not charge, obviously, a fee,
Correct.
and insurance doesn't have to be involved, but you guys also compensate, right?
Right, and we appreciate people coming in and participating with us, and part of it, we know they take their time away from their work or their family, so they do get a little stipend to assist them with time and travel each time they come in.
And so chronic pain, though, is not the only clinical trial that you're doing. You have others that you're involved in.
Absolutely. Outside of the chronic pain, we have hypertension, depression, bipolar disorder, attention deficit disorder for both adults and children, teenagers specifically. We also have people who are having side effects from their antidepressants, who are having a low sex drive, and we soon will be having one for diabetes as well.
For people at home that are wondering, is this safe? The products that you guys have are actually further along in testing.
Right. There's several phases in the clinical trial process. Your phase 1 or the smaller trials are looking more at safety and things of that nature. Our studies are often phase 2, phase 3, sometimes even phase 4 studies where the patients have been evaluated with the medications. The products have determined that they are effective in many ways, that their side effects are minimal, and so that you can feel comfortable participating in the trial without the risk that you might think.
Well, great. Well, thank you so much for giving people at home an option. We want to thank Susan, of course, for being here, and CNS Healthcare for sponsoring this segment.
To find if any of their trials are right for you, just call 904-281-5757 and make an appointment for a free 30-minute evaluation session. Or you can also log on to their website, cnshealthcare.com. Remember, all of their services are free.